I got into healthcare because I've always had the desire to help others. I guess it's something that has been instilled in me, my culture, since I was very young. My parents are from Nigeria and my family lives in Atlanta, Georgia. My parents always encouraged being a part of something bigger than yourself and serving others. That was a huge theme in our household. I actually started by studying physical therapy, and I wanted the clinical experience. I loved the connection I had with my patients. There was something that really inspired me every time I got to interact with a patient. And I thought, there has to be something better. There has to be a way that you can speak and it matters and it changes the process. And so with that being said, I kind of started to change my direction into administration because I figured, this is the opportunity that I've been waiting for to speak and speak for myself and speak for others who may not have that opportunity. And then not only speak, but make a change because you're in administration. And I have a global perspective about it. There are many different people, many different backgrounds, and so we need people of different backgrounds, different cultures, different ethnicities to have a voice at the table and to speak on behalf of all those people. And I think collectively, when that happens, you get the best kind of healthcare that you can imagine. So I found out about the James Butler Fellowship after doing some investigating. I was like, I've never really, looked at Lansing, Michigan before. And so I typed in Sparrow Hospital and I came to the website and I was like, oh, I want to know more. So I started to kind of like YouTube it. And that's where I saw a physician kind of speaking about their experience here at Sparrow. And one of the messages that he said was it was community-led and community-owned. And I was like, wow, it's beautiful to have an impact on not just a small scale, but for the community as a whole. And so with that, I started to really gain interest and traction in the fellowship. And then when I came here for my interview, they explained a little bit more that this wasn't just your normal administrative fellowship, but it was named after a person, James W. Butler III. And I was like, wow, not only do I get to do an administrative fellowship, but it means something to the community and it means something to somebody's life. It's their legacy. Every time I go into the community and people talk about James Butler, I feel like I just missed a celebrity. He made people feel important. And it's evident through the stories, through people's faces and just their actions that he was very impactful and intentional. He didn't just live to do his job or just live to get anything checked off the list. No, it was very intentional with his interactions, and he inspired a lot of people. The fellowship is basically an opportunity to see behind the scenes the whole health system. And I think you learn parts of it in school. You experience parts of it, right? You do physical therapy, you do OT, you do nursing. You look at different, certain particular areas within healthcare, but to see healthcare as a whole is a unique experience. So this fellowship basically opens that door. I get to see everything and I get to actually be a part of it. It's also an opportunity to learn how to lead. I get to interact with so many different leaders, from frontline leaders to our executive leaders and to the board. I get to watch them work and make decisions. And you get to see it in an array of ways, how people make decisions under pressure. Look at COVID. How people make decisions for the future. What are our short-term, what are our long-term goals? And so I think that's kind of what the fellowship has been. It speaks volumes about Sparrow and the direction that they're looking. They invest in, young talent and the future.